At first, I was going to tell you that I'm really proud of New York because Governor Cuomo has really helped us see, has declared that while we have social distancing, we have spiritual connection. Everyone we're encouraging to work together to create a great possibility of overcoming this virus soon. Now, however, just a few minutes ago, I heard from the New York Post that actually New York State, hospitals in New York State are using intravenous vitamin C to treat their patients with coronavirus. If you followed my work, you'll know that even before we heard of this virus, I was talking about the great capacity of vitamin C as an antiviral. I wrote a blog on 9,000 cases of healing with vitamin C, which was the work of Robert Cathcart, a physician in the 60s, 70s, who healed thousands of people with high-dose vitamin C. It has been known to be the best natural antiviral that is available in the world. The Chinese started using this antiviral. I reported that to you, and you can find a whole history of how the Chinese have been using that with their dealing with COVID. I'll give you a link to the Orthomolecular News Service where it's reporting all of this. And now we see that in New York City, this two Northwell hospital facilities in Long Island are using intravenous C right the first thing when the patients come in. And what they're giving is 1,500 milligrams of intravenous vitamin C, and they're giving that at 4 different times during the day. That's about 6,000 milligrams. Now, in the Chinese studies, they used 14 and 24 milligrams. In Korea, they've used up to 30,000. In China, they used from 12,000 to 24,000 milligrams intravenously. In Korea, they used up to 30,000. And so New York is starting. Maybe 6,000 isn't quite as much they've used in other countries, but it is such a breakthrough that vitamin C is finally being recognized in this country as an inexpensive, very powerful adjunct treatment. Of course, the patients with corona are also getting medical treatment with the new drugs they're trying out, but they're adding vitamin C, which we are so delighted to see. And in fact, the physician reporting this said that they're copying because the Chinese had great success. He reports that the patients who received vitamin C in the Chinese trial had significantly better results than those who didn't get the vitamin C. And then this Norwell hospital group operates 23 hospitals, and they said that vitamin C was being widely used as a coronavirus treatment throughout the system, but that the medications varied from patient to patient. It was very interesting. There's about 700 patients are being treated for coronavirus in this hospital network. And it's not clear how many of them are getting vitamin C, but it's being introduced as a protocol. It's interesting that some of the physician who is in charge of this said that the vitamin C levels in coronavirus patients drop dramatically when they suffer sepsis, an inflammatory response that occurs when the body overreacts to infection. And you know, we've been teaching for months now that your need for vitamin C varies according to the challenge. Like when you have an infective challenge, a challenge of infection, there's a great demand for vitamin C. The white blood cells really drop their vitamin C, and if you give them vitamin C, they stay much more potent, much more active. Tomorrow, I'll be going into more details, exactly if you want more details and answering some of your questions about vitamin C. But I just want to also mention what this physician at the hospital said. He says, it makes all the sense in the world to try and maintain this level of vitamin C. Finally realizing that nutrients, and particularly vitamin C, is so important for immunity, and that we drop our levels of vitamin C dramatically when we're sick. You might have noticed yourself, when you're healthy, you might say, gee, I can take 4 or 5 grams of vitamin C, don't get too much loose stool. When you get sick, you may say, I can take 20 grams, and you don't get a loose stool because you're using all of that. These people go on to say, a clinical trial into the effectiveness of intravenous vitamin C on corona patients began in China in February, and they're really copying this Chinese experience. And of course, I would say the Chinese copied the American experience, because decades ago, soon after vitamin C was discovered by Albert St. George, you had physicians like Dr. Klenner, Dr. Cathcart, Dr. Lendon Smith using very high-dose vitamin C, and they documented their work. And we have we have offered you these reports and their studies. You can find them on Alkaline for Life on the link we're giving you here. And you can also find the link to this New York hospital study. I congratulate New York for taking the step to see how can we save people's life and how can we boost everyone's immunity. For all of you there in the audience, what they're giving IV is about 6,000. 6,000 is we're saying people should take between 3 and 6 just as a prophylactic to keep their immunity strong. I certainly personally take much more than that, but you will know if you ever have too much vitamin C, you're going to get a loose stool and you cut back. We'll be talking more about the details of vitamin C and how to use it tomorrow. But tonight, in this little short broadcast, I want to thank New York State for getting on board and looking for the simple, natural treatments that can be used along with the drug therapy. Interesting thing I was going to tell you also is that the Rodin Clinic, RIORDAN Clinic, a clinic that has for decades promoted the work of Linus Pauling and vitamin C. Now they offer, in their clinic, you can walk in the door and get an IV of vitamin C of 7.5 grams. That's just about as much as they're using in the hospital. The hospital is dosing it out a few times a day. They're giving you one shot. Just to know that it's so interesting. In Kansas, you can go in and get a shot just because you want to boost your immunity. These people have known about vitamin C for a long time. Now we've got mainstream medicine saying, let's give it a try in treating this very serious viral infection. Everyone stay safe. Remember, we should keep up that social distancing. That's one way we can cut this short. Take your vitamin C and all your antioxidants, and we will talk tomorrow.